Thank you for being here this evening, Dr. Michael Averbukh of
My
Serenity.
pleasure, as usual. Thank you very much for hosting me.
Well, we want to talk to you tonight about transferring healthcare to Portugal, the essentials, and that's what we'll do with the aid of a presentation that you have at your end, which we'll talk through, won't we? There's a lot of useful information on there, and we'll pause from time to time to chat, and there'll be a good chance to ask questions at the end of the presentation as well. Do pop your questions. If anything occurs to you, pop your questions into the chat, and I'll do my best to round all of those up and make sure they get to Michael, and we will have our usual hands up, mic on session much later on as well, where you can ask personal questions when the recording isn't ongoing of the doctor. Not too personal or intimate, I hasten to add. So over to you, Michael. Thank you so much for being here.
Thanks again. I'll just share my screen. Just tell me that everything is going okay. Get this done. And here we are. I hope that here we are. Here we are.
We can see it. Thank you very much.
Great. So good evening, everybody. And yeah, this is a very interesting weekend. It's a holiday. Sorry. It gets me confused each and every time. So we had a holiday with a very, very rainy holiday eve yesterday. We're better today. And what I'm going to do today is to talk about transferring your healthcare affairs, everything that concerns you in terms of healthcare, on your way to Portugal, or when already arrived in Portugal, or when already 2 years in Portugal and still haven't resolved your issues, concerns, etc., etc. People that do not know what Serenity does, so just a small recap. What does Serenity do for a living? By the way, you know what? I'll start with myself. My name is Michael. As Carl kindly presented me, I am a medical doctor. I'm not from here, so I share your passion to Portugal. I am an expat here as well. Live here for the last 2 years. Work with Portuguese systems already for 10 years or so. And I'm the CEO of Serenity. And what we do for a living is actually take our clients hand in hand and walk them through this labyrinth of the Portuguese healthcare systems, both private and public. We literally help you with everything that we can and everything that concerns healthcare systems, be it a clinical concern or be it an administrative concern, be it finding the right insurance, or be it registering you with the SNS, with the National Healthcare System. Be it a symptom, be it a disease, be it finding a proper physician. This is what Serenity does. We will touch insurance quite a lot on this conversation, and we touch insurance in general a lot, but Serenity isn't an insurer. Okay? We're not an insurer. What we do is advocate for our clients when it comes to insurance issues, when it comes to utilization of your eligibilities, again, through the public system or the private system, we're there for you. And another important thing, people sometimes ask us, yeah, but so we will wait until we get a residency because we cannot become members before, so you can become members whenever you want during your journey to Portugal or your journey in Portugal. Just wanted to clarify that. All right, essentials, as promised. We wanted to make it simple, and we wanted to keep it in a way that people will understand, and we will be able to address the main questions that people ask us. And we focus on this task of being your concierge in Portugal for 2 years now. And we have quite a lot of experience with quite a large number of clients and humongous number of encounters with clients. So we just purified it in a way, minimized it to the very, very essentials of, hey, I'm on the way to Portugal. What do I do with my healthcare concerns? I'll touch quite a lot of tasks and issues on this webinar, but as Carl mentioned, kind of feel free to ask everything on the chat box or later on when we stop the recording. I'm here to answer as much as I can. I have here other people that will help me. So let's get to it. 3 essential steps, 1 to 3, as easy as that. First one, you have to secure an appropriate healthcare insurance. And of course, I will go into deep and explain when and what and where. You have to secure the continuum of care. The reality is that the vast majority of people moving to Portugal are not in their 20s anymore. I mean, now with the nomad visas, maybe we'll see a flood of young people coming in, but people are coming to Portugal with a little bit of a more progressed age, me included, for example. And we carry with ourselves a little bit of need for a continuous care. So how do we make sure that everything that we got back in the UK or in the States or in Canada would come along with us? So this is step number 2. And step number 3 is the Portugalization, what I call, of all my meds. This is another big concern. I have a bunch of meds, or even only 1 or even 2, and then like, okay, I'll come here and I do what? Where do I get them? We will touch all of this and all the spin-offs of those major 3 pillars. So again, health insurance, continuum of care, medications.
That's so good, Michael. Thank you. Portugalizing. What a great word. And I'm surprised we haven't heard that before, but you can make a movie. You're the Portugalizer, aren't you?
I'm the Portugalizer, and please, everything, since starting this moment, every time you say Portugalizing, I want my fees.
Yes, I know.
You know. Thank you. You're so kind. Anyway, health insurance. And by the way, we have Nuno here on the show, the savior of yesterday. I'm the Portugalizer and he's the savior. So
what a duo.
He will help us with all with insurance questions that I will not be able to answer. So appropriate health insurance. I said first step, or one of the 3, is getting an appropriate healthcare insurance. I'm from Israel. So Jews always answer with, or Israelis or Jews answer also always with questions like, so like, what is an appropriate healthcare insurance? Come on, like, let's be wise. So to that, I have a very simple answer. It depends. And it depends actually on 2 major things. One, the first answer to what is an appropriate healthcare insurance is, what are the demands of the authorities? And here you practically have 2 basic demands through your journey. One is the demand of the consulate when you submit your paperwork for visas, etc., etc., etc. What the consulate will ask you to present is practically a travel insurance, a healthcare insurance for travelers. And it has to fulfill 2 very minimal demands. One is the capital. The capital that the Portuguese authorities would ask you to have is the minimum of 30,000 euros. This is quite a basic insurance. That's just for you to know. Nothing complex about it. And the second one is that your insurance should include a clause of repatriation. That being said, meaning that if something very, very bad happens to you immediately upon your arrival to Portugal, the insurance will cover the costs of flying you back to your country of origin. Why do I even talk about it? Many people get a little bit confused with this issue of what insurance do I need, why, when, etc., etc. And many would say, hey, I just want to buy a health insurance. Great. When buying a health insurance, wherever you want to buy it, in your country of origin, you want to buy a health insurance already from a Portuguese provider, whatever it is, the normal health insurances, the majority of them, would not have this evacuation/repatriation clause, and hence they would not be adequate for the ask of the consulate. So just be aware of that. These are actually 2 different products, the kind of comprehensive health insurance that you want to have when you are in Portugal, or the health insurance that the consulate asks you to have for the application of the visa. Another important thing, this insurance for your application stage is a short-term insurance. You practically don't have to buy it for a year or so. You can easily go for 4 months. These are the demands for the application. Another stage of the demand of the authorities is when you encounter or where you meet the CEF, the authorities of immigration. This happens after you have arrived to Portugal. You've been here for a couple of months. Actually, today CEF appointments are like scheduled for, I don't know, 6-7 months after arrival, right? Carl, this is what we hear.
Yes, there's been a little bit of a surge and spike in the workforce, which has meant surprisingly, quite surprisingly, as we found out from Gilda on Monday, Tuesday, that some appointments have been brought to the other extreme. They're happening very quickly. But yeah, generally speaking, you're absolutely right. It's just people might want to be aware of that. It feels like there's been a little bit of a shake-up of CEF this side of Christmas, which actually nobody was expecting. So
right,
interesting.
Good news, right?
Perhaps, yeah. But yeah.
All right. So whenever your CEF appointment is due, the authorities here ask you for for a simple thing that becomes very complex, as everything in Portugal. When you come to the CEF appointment, you need to come with a long-term solution for your healthcare. Long-term solution for your healthcare can come only from 2 origins. One is buying a private health insurance. This time, a comprehensive health insurance. Normally it's a contract for a year or so from any insurance company, of course, around the world that would cover you in Portugal. The cheapest and the most efficient way to do so is to buy insurance from a local provider of insurance. Easy. Second option, and here comes the Portuguese twist, second option is to be already registered with the national healthcare system. And here's the punch to the twist. You can't register with the SNS, with the national healthcare system, without having residency. So actually, CEF is asking you sometimes to be registered without having residency. Can't happen. Mm. I'm telling this small story just to emphasize that practically, the only normal solution for you to have in hand when going to your CEF appointment is to have a private health insurance in Portugal. I hope this is clear.
Yep.
So again, appropriate health insurance. If you follow up the demands of the authorities, you need a travel insurance with the application, and you need a comprehensive health insurance when going to your CEF appointment. These are the asks, the formal asks of authorities. And now let's talk about what you really need as a person going to live in Portugal. Here comes a very simple advice. Portugal provides several kinds of insurances. The very vast majority of products of health plans are structured as an add-on to your public eligibility for healthcare. And as public eligibility for healthcare in Portugal is quite wide, actually it encompasses everything, some insurers would give you a plan that is absolutely not sufficient if you really want to use it. If you really want to use your private health insurance, you should opt and buy and look for a comprehensive plan that would have enough capitals and enough coverage for inpatient treatment, that would have enough capital and enough coverage for outpatient, that would provide you with a solution for dental issues, that would provide you solutions for pre-existing conditions, as an example. Another thing that is very important, that would provide you a solution even if you're 68 or 72 years old, because many of the insurers in Portugal, again, structured as a add-on plan to your public eligibility would say, we would only insure you if you're below a certain age. Or if you joined our insurance at the age of 59, we can only insure you up to the age of 65. And at 65, we'll tell you, hi, Michael, good morning, happy birthday, we can't insure you anymore. And we don't want that. I mean, that would be ridiculous to buy an insurance plan, start paying for it, and find out that when I get a little bit older, they don't want me anymore. So what I'm saying is, when looking for this comprehensive health insurance plan, look for something that fits your needs. If you're 20, it's easy. If you're 60, look for a company that would not throw you out in 5 or 10 years. Look for a company that would cover everything you bring along, your hypertension, your hypercholesterolemia, your stent in your heart, or your diabetes. Look for these. So this is kind of a little bit about appropriate health insurance. And again, we will touch it probably with questions that will come up. Mm-hmm. Another important question, when should I buy my insurance plan? So there's an easy answer for this, saying like, when you apply for the visa, you need to buy your travel insurance anyway. So this is, the timing here is easy. But later on, there's this question of, okay, so I'm waiting for my visa. It's supposed to come in 2-3 weeks. And then I'll take another month, and then I'll fly to Portugal. So do I buy the insurance now, or do I wait? Or maybe I'll come over because I still have my travel insurance active, and only when the travel insurance is expiring, I'll buy a plan. And here again, the thing is, and the advice is, look for what suits your needs. Why? Some of the insurance policies, even the very good ones, would apply some waiting periods. Those waiting periods can be 60, 90, 180, 360 days for different conditions, for pre-existing conditions or not pre-existing conditions, for elective surgeries, and so on and so forth. So I would advise to ask, inquire, study, receive proposals relatively early, within your journey. I mean, not 2 years up front, but when you submitted your paperwork and you're waiting the visa, I think it's a good time to start looking around. And then maybe you will just discover that you want to buy a plan even prior to coming to Portugal, because it has certain waiting periods, and you just want the insurance to be fully active, to kick in fully when you land. So this is a consideration. And a very important thing of what not to do. Probably people that saw me on different occasions already know what I'm going to say. But what not to do is, please don't get tempted with buying something that looks as an insurance, but it's not, like discount cards from the Automobile Club of Portugal, a very nice club, by the way, and they're selling some pseudo health insurance plans, very cheap, but they are not an insurance. They are a discount card, meaning you have a plastic card that will give you discounts between 5 to even 50% somewhere in a clinic or whatever. But again, this is not an insurance. Please don't do that unless you really understand what is it that you're doing. And another thing that is it's a very common error, and this is why I'm totally against it, but again, this is my perspective. Please don't be tempted to buy insurance in your bank. Banks will normally, when opening your account, will tell you, hey guys, we know that you need insurance. Here's the thing, just sign here and here and here, and we will deduct this 50 euros or whatever euros from your account on a monthly basis. Very simple, very convenient, and very cheap, for sure, for people coming, for example, from the States. You'll see like you're paying in the States $1,500, $2,000 per month per person, and here they will give you like a good policy for 100 euros per month. Don't do it. Because although very convenient, normally the banks would not be able to do a very important thing, and this is to kind of adjust the right plan to your needs. The bank wants to sell more insurances, more services and whatever, and hence they will do whatever possible in order to facilitate this sale. Please don't do it. Stop for a second. It's okay to say, you know what? Thank you for the proposal. I'll think about it. Go home, do your homework, ask questions, ask somebody who understands insurances, meaning a trusted broker. Ask us. I told you we're not a broker, but we are your advocate on that. Mm-hmm. Ask us, we will tell you if it's worth or not. So don't be fast on signing up for some kind of a plan that somebody told you that it looks good. Let's go further on.
Well, thank you very much, Michael, for the insurance section. And thank you, Caroline and Keith and Barnsley Poo, for your question there. We'll come back to that. It's a really good question. And with your permission, Michael, we may include Nuno later on for his perspective. But that's a very frank rebuttal of bank insurance there. But you're absolutely right. You need to know what you're signing up for. And a plan isn't necessarily an insurance, which is another key distinction, the what not to do thing that you mentioned there. So thank you very much. So on to the continuum of care then.
Continuum of care, the second pillar of our journey with healthcare. I brought it as a first bullet, and actually I printed it in bold. Plan ahead. Plan ahead, because this continuum of care can be something very simple that even talking to us, we will tell you, hey, this is nothing. I mean, this is a no-brainer. Like, hey, I'm having issues with my thyroid and I'm a little bit concerned. I need some blood work from time to time and I need some medication. We say, come on, this is really, really simple. And there are issues that seem simple, but they really would take a certain process to be executed and to be continued in Portugal without breaking in a way the structure of care, the structure of treatment. And I'll give you several examples, but I'll go a little bit into the sub bullets here. First, and this is important, like except for the fact that you have to plan, be advised that in the very, very, very vast majority of cases, I mean, that would be very rare that we cannot find here a solution for something you have. It will be tremendously unusual. So kind of chill down. Everything will be solved, but it will be solved in a different way than you're acquainted with. We have many clients saying, hey guys, like, but in the States, or but in UK, or but in South Africa, we had it in a different way. We respect that, great. But you're not in South Africa, you're not in the States, for the good of it and for the bad of it, okay? And some of the very simple things that you have in your countries of origin will be provided here just in a different manner. And we all have to respect it. I mean, I'll give you simple examples. Good and bad. Somebody would say, look, the only thing, I'm 40, I have only one single issue. And this is a very bad eczema. This is a skin condition, nothing systemic. This is not cancer. This is not complicated diabetes. I have an eczema. But my eczema, when it erupts, it erupts quite tremendously. And all I need is an injection. I take it once in every 2 weeks. It's tremendously expensive. This is why my insurance is very expensive in the States. And I went through a great deal of paperwork, etc. But once it was approved, everything works like a Swiss clock. I receive my injections, I do all good. And all I need is to get it done in Portugal. And this looks very simple, like, hey, injection. Well, the good thing is that you're going to get your injection here, but the process is totally different. The same injection for which you pay a tremendously expensive insurance in the States, and then even maybe you have some co-pays or deductibles, blah, 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 all of this will be provided most probably with a high percentage of assurance. I tell you this for free. You will pay €0 for that. Great, isn't it? But there's a small but in it. There's a process behind it. And this process might be a bit lengthy. And if you just say, hey, it's going to be okay. Portugal is a great country. Public service, private insurance, I'll get it, no problem. And you land here and you do not have your injections with you for whatever reason. And you just think that it's going to be okay. Here's a bad surprise. It's not going to be okay on your first day here. No, because there's a process behind it. To get this same injection, the biosimilar, that costs a couple of thousands of dollars or euros. Even in Portugal, if you try to buy it privately, actually, many of those medications aren't available for sale even. To get it for free, you have to pass a certain process. And with our help, for example, we will do it efficiently, relatively quickly, but you have to have several steps in it. So if you plan ahead, see the first bullet here, if you plan ahead, we will tell you how to prepare yourself for this transition. And if you don't plan ahead and you land here and you say, okay, guys, now I'm here, I need the injection, this is a problem.
Okay.
So this is kind of the bad example. And another simple example is, hey, I pay for my medications, regardless insurance in the States, whatever I pay, $200-300 per month. Would you tell me how much would it cost in Portugal? And we have those clients almost on a daily basis. We check it and we say, well, it will cost you €5 per month. So they were like, what? Mm-hmm. Yeah. So that happens as well. The only thing is, again, plan ahead. Another very popular question. I have all my medical file on a CD-ROM or on a disk on key. It's like gigas of interactions, whatever. What do I do with it? Not a lot. Portugal doesn't have a unified medical file in a way. So for the time being, at least, you don't have nothing to do with it. You can bring it, save it with you. But there are important parts of your medical file that should be brought. As an example, your last mammography. Very important, because mammography, you will repeat it in a year or two. And if there are any kind of findings there, the first thing that the radiologist will ask you, or the breast surgeon will ask you, is like, where's your prior mammography? Bring the disc, the images, something, because the comparison is very important. You have a heart condition and you know that your ECG is at the baseline, is not exactly the textbook. Bring your last ECG with you. This is important, okay? And there are numerous examples, and the bottom line is, like, don't bring all the gigas and the papers and whatever of all your medical file of the last 50 years, but please ask us what is relevant, and please bring the most relevant ingredients of your medical file, because it will make your life and our life as your advisors and steering committee easier.
And generally speaking then, Michael, a day-to-day general practitioner is not going to be interested if you rock up with a concertina file full of your old medical records.
Thank you for this question. It's an excellent question because not only that I have an answer, I have something to talk about. So this is part of the last bullet, okay? Many people tell us, hey, not only that I bring my medical file, I spoke to my GP or my cardiologist and he said, hey, John, when you get there, just put your GP online and I'll tell him everything about you. Very nice. Actually, this is the approach that we love. The thing is that I am not absolutely sure that at least not each and every Portuguese physician would be happy to do it. It's a little bit of a mindset that is different. Like the physician that you will meet for sure in your first encounter, maybe the second or the third, and you tell him, doctor, my doctor in the States wants to talk to you. I wouldn't build on that. Okay. We do it a lot. We do it a lot, and we do a little bit of a bridging between those mindsets, because the mindset of a physician in the States is totally like, hey, here's all the information. I want to share it. It's very important. It's again, it's a different type of approach. And in Portugal, hey, I don't need anybody to tell me what to do or what you have. I know everything. So, I mean, when you're transferring your care together with this continuum, this bridging is very important, because many times, and we have it really on a daily basis, people come and say, hey, but my neurologist said that he will talk to the neurologist here and everything will be okay, and I have multiple sclerosis. And we say, yeah, it doesn't work like that.
Interesting.
So
this is a cultural thing, isn't it? In the sense
it
that
is.
Yeah, quite traditional approach. It's not like a collaboration between the patient and the doctor. This is the doctor as a professional person, and they will be leading the process.
Yeah, and not everybody likes this, and this is where we come handy again, because we know how to balance it.
Yeah.
And when it's really, really crucial, we will talk to the Portuguese doctor in Portuguese with the right approach and soften this landing field and say, hey, we really want to create here something different. And actually, it takes us quite a lot of time to find physicians that would be open even for this idea, unfortunately, but it is what it is.
Yeah.
This is why I'm saying we will find a solution, but it will be different.
And manage your expectations.
Absolutely so. Absolutely so. So this is with regards to continuum of care. Let's jump for let's jump for the next slide. And here's my trademark.
The Portugalizer. We'll see you now.
Portugalizer. Portugalizing your prescribed medications. This is an interesting chapter by itself, because we can dive here into various different examples and speak a lot about it. I will try to minimize it to some main takeaways. First of all, again, many people moving to Portugal are concerned with, look, I'm taking this and that and this and that and whatever, and probably you don't have it there. Well, the good news, we have everything. Practically speaking, after thousands of requests, literally thousands of searches and transmission of medications from different countries, we came across 2 medications only that aren't available in Portugal. One of them is a bovine preparation for thyroid. It wasn't approved by the European Committee of Medication, so it's not available in all Europe. This is one. And the second one is a very specific mixture of active materials for ADHD, for attention deficit disorder. All the rest, and by the way, both have decent substitutes. It's only a matter of telling us up front, I'm taking this and that, and we will find the right substitute. So no worries. You will have whatever you're having, you will have the parallels, maybe under a different name, maybe under a different color of packaging, or etc., 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 but you will have it. Mm-hmm. So this is important. Now, when coming with medications, like many people would bring a little bit with them, which makes all the sense in the world, because you never know when I land in Portugal, what will happen tomorrow and after tomorrow and in the first weeks. All good. But then the question is, okay, but I really need a refill. Who can prescribe? So here's the very simple solution. First of all, pharmacies in Portugal have very nice people inside. The pharmacists in Portugal are very helpful, very knowledgeable, by the way. And many times they would take the initiative and the responsibility to fill your prescribed medications based either on this bottle that many people from the US, at least they know. It has your name, your ID, etc., etc., the medications, the dosage, and they will just fill it in for you. Fill it in, I mean, not the bottle, but they will give you the prescribed medications. This is one. Second, they would normally see to filling your prescription, even if it comes from abroad. If it's English written and it's like very clear what's written there, they will give you the prescribed meds. The bad news, if I can even call it bad news, is that this is not a solution forever. So it will happen once, maybe it will happen twice, but not on the long run. So you will have to find somebody in Portugal that will prescribe your meds. Practically, each and every physician that you will go to, I mean, you should find somebody who speaks English, etc., etc. This is part of the reason for our existence, but each and every physician can prescribe your regular meds. As long as you tell your story, you show them that you've been taking this for years, months, whatever, they will be prescribed for you. Some physicians will tell you, look, I would very much like to review your meds and to check you up and to understand if we can improve, correct, whatever, but this is natural. Each and every one of us, medical people, would not want to be just a secretary writing your prescriptions. Makes all the sense in the world, I believe. So this is very important. Again, this is kind of the first and quick gains. You will get it, no problem. Each and every physician with a license will prescribe it. Now, how much does it cost? Does the insurance cover it? So on and so forth. So first of all, medications in Portugal, the normal, let's call them normal medications, not the biosimilars that I mentioned prior, whatever, but the normal line of medications, diabetes, hypertension, cholesterol, thyroid, anxiety, depression, all of these are medications that are relatively cheap, like 5, 10, 20 euros per month, something like that. Not a very big expense. Now, what happens as well is, as soon as you are registered with the SNS, as soon as you are registered with the national healthcare system, you will be provided a registration number, número do utente, SNS number, whatever you want to call it. When a prescribing physician, be it wherever he is, if he uses the national platform of electronic prescriptions, and this is a platform that works tremendously well in Portugal, when he uses this platform and he puts in your SNS number, when you will go to the pharmacy, you will be handed the medications and the price will be really ridiculous. There's a copay of 50 cents, 1 euro, 3 euros or something for medications that normally would cost you, for sure in the States, several dozens of dollars, if not several hundreds of dollars. So having this SNS number is very important. It allows you to use medications for much cheaper, and through the electronic prescription system, it works tremendously well. Actually, when the medication is prescribed, you get an SMS on your smartphone with a certain code. You go to the pharmacy, hand the code to the pharmacist. Everything then is provided to you. You pay the small symbolic copay, and everybody's happy.
Very good.
Okay? Yeah. What differs very much from the States, for example, or from other countries, insurances practically do not pay for medications, just because, remember when I started and telling you insurances are an add-on on the public eligibility? This is the very best example of that. Insurances would either put a small amount of money, a very small capital of 200, 300 euros per year for your medications, having in mind that this would be used by you only for acute cases, or would not even include medications in your cover. But that even makes sense, because if the state pays for it, great. So you don't need it in your insurance. Part of the reason why insurances here are so cheap, by the way. Okay, so when people are saying, look, I need insurance because I need the insurance to pay for my medications, great. I say always, very well, the reason why you need insurance is wrong. It's not to pay for your medication. There's a small catch here in all of this explanation. If you remember, or you know already, I mentioned that you have this registration with the national healthcare system only after you had your residence permit. We mentioned that SEF appointments, if the good news that you brought are true, so the timeline to get your SEF appointment is being shortened, but if you still have a SEF appointment in like 7 months, what do you do in between? So sometimes what you do in between is actually getting your prescription and paying privately for the meds. Sometimes the meds are cheap, no problem. You will pay $10, $20, 20 euros, apologies, and you will bear with it a couple of months until you have your SEF appointment, until you're registered with SNS, until that becomes a non-issue. Some patients, though, some clients of ours have medications that when bought privately do cost 50, altogether taken would cost 50, 60, 70 euros per month. When it becomes a waiting period to SEF of another 7 months, we're starting to talk about some substantial amounts of money. Not that I have here a magic solution, but here we go again to something that we mentioned prior: plan ahead. Know what you're facing and talk to us, for example, about possible solutions, because there are some. And the last thing that I want to mention is special medications and special processes. I already gave this taste a little bit of special meds, biosimilars, specific insulins, anti-HIV drugs, by the way. All of these, they have quite a high price if you want to purchase them privately. Practically speaking, many of them are not sold in Portugal. You can't get them. Like anti-HIV medications, you can't just go to a pharmacy with whatever prescription you have and buy it. They aren't sold. Biosimilars, in the vast majority of cases, you cannot buy them in the pharmacy because they aren't sold. They are provided for free through the pharmacy of a public hospital. But in order to get them for free, you need to go through a specific process. They need to be prescribed by a specific expert from the public sector. And again, you will need a little bit of guidance how to do it. and you need a little bit of guidance. There's a little bit of process. Together with that comes a little bit of time. Saying again, plan ahead, talk to us, understand how it would be done, and you will be granted medications that you know to be like $10,000 per month cost. You will get it for free. Again, with a process, with a planning, with understanding what it takes.
Mm-hmm.
So I'll just recap. 3 pillars, okay? Insurance, continuum of care, medications. It's relatively simple if you follow some simple essential steps. Planning ahead is one of them. Asking the right questions, having the right timeline to do things when they're supposed to be done, and your integration into the Portuguese health system will be as friction-free as possible. So actually, to this part is my official presentation, and I'm open to take all the questions in the world. So.
Superb, that's brilliant. So distilling it down there to insurance, the continuum of care, and the meds, the prescriptions, that's really helpful as an aid memoir for people to remember that, Michael. And thank you for detailing some of the complexities there. One thing I'd like to pick up on, if I may, is the SNS, the UTENT number, which sometimes strikes fear into the heart of new expats in the country. And it's a great relief to many that you help with this.
Yeah, actually, we manage it on behalf of our clients as well. It's another process in Portugal, and those that already had their residence permit after this the CEF appointment, it's relatively easy going forward. The thing is that there are quite a lot of people that would need something a bit different, so that would need something a bit unique. And here, where our ability to understand the need on one hand and understand how to speed up the processes comes very handy.
Very good. Okay, thank you for that. I wonder if you could close down your presentation now.
Yeah, sure.
My Zoom is in. I got me into trouble. My Zoom is in Portuguese, and sometimes I get a little bit scared in these difficult situations about pressing the wrong button, which I did on Tuesday. So, Michael, that's superb. Thank you very much indeed. A great relief, and we do have a great relief to people coming to Portugal that you are the case managers and the helpers, the medical concierge. We're lucky to have Nuna with us tonight, who can answer specific insurance questions as well. So let's go to the first of the questions that came in from Caroline and Keith. Michael, this is very helpful. Thanks. And also Barnsley Poo had the same question here as well. Does healthcare insurance have to be covered by a Portuguese provider? I am retired on US Medicare with a private supplemental plan. I cleared it with the supplemental provider prior to starting my travel, and I am covered outside of the US with a minimum deductible. Will this be sufficient in Portugal? Same question for Barnsley Poo as well. Presumably you've dealt with a precedent like this before.
Yeah. So look, as I want to mention something important. Again, there are those 2 things that I mentioned through my presentation. First is what is the request by the official authority. So official authorities would like you to have, when already in Portugal, of course, they would like you to have an insurance that would cover you while in Portugal. And if you have an insurance from the States, Canada, Israel, Zimbabwe, whatever, when you go to CEF, just make sure that this insurance paperwork states that this insurance is valid globally, or if they write specifically in Portugal, even better. Mm-hmm. Because we already had examples of people that came with a global insurance, whatever, best in the world, but the CEF people that are not acquainted with that, they look at the paper, they say, this is not Portugal, this doesn't say anything, thank you so much, come again. Mm-hmm. And try to come again.
Yes.
So if you have a global insurance that assures you, okay, and you want to answer CEF requisitions, please try to come with something that states that this is a global insurance or it's valid in Portugal. This is one. This is what you need officially. Now, what is it that you need personally? If you are sure that your insurance, wherever it is, States, Canada, or whatever, is covering you in Portugal, that's great. Be advised that those global insurances would always cover you based on reimbursement, meaning you will have to go to whatever private place you want, pay out of pocket, have your invoice, and then claim the reimbursement, which is okay. The only thing is that please be advised. Talk to your insurance and be very specific, asking if the insurance would accept paperwork in Portuguese, for example. Mm-hmm. Because what you will be handed here is a Portuguese paperwork. You will be handed a Portuguese invoice. You will be handed a Portuguese medical report. Yeah. And if you send it to the States, even if they say that they cover you globally and it's not in English, you will encounter problems. Again, what I'm saying, if you are in doubt, ask somebody that understands. It's by far more convenient to use a Portuguese provider. It's not an obligation, right? So you have a great global insurance, be it in the States, be it Medicare, be it supplementary, whatever. Talk to us, talk to somebody who deals with insurances. We tell our clients many times, send us please your policy. We will read through it and we will tell you. Yeah. And just recently, a client that went to SEF, she said, I'm totally sure that I have the very best insurance in the States. It covers globally. And I said, great, send me please the paperwork. And she sent me the paperwork. There's a 150 pages of cover explanation. And on page 89, paragraph 9/A/small b, it says the cover is global. And I said, look, I don't care, but try to go to SEF and tell them to read through all of this and approve it. Yeah, it's a risk. It's, I mean, and she said, you know what? I'll do something. I'll do something local.
Yes. So it's really about where it's focused, i.e. Portugal, rather than where the company is based. I noticed that Nuno was nodding knowingly through a number of points that you made there. Did you want to add anything at this point, Nuno, to that?
No, regarding what kind of insurance is accepted by SEF, actually, Michael told everything. It depends.
Okay, you're right. A classic Portuguese answer. It depends. In Portuguese, what is the phrase "it depends" in Portuguese, Nuno?
Depend.
Oh, okay. So it's the same.
Depend.
Yeah.
All right. Excellent. All right. Well, thank you for your input, Nuno. And, we're lucky to have, as I said, Nuno here this evening.
No, but there's another thing that Nuno didn't mention. Like you come to SEF and you say, yeah, but this is written, and then the reply is Pois. But it's not what we're acquainted with. Pois, like but and sometimes this pois, you look at them and they say, pois, come again.
So this is a very interesting point that you've made, that kind of is the essence of what we're talking about, and the cultural shift. And I've heard this said before, that people are coming sometimes from transactional countries where lots of things are reduced to transactions, and you're coming to a country which is very relationship based, relational. And that refers, I think, and connects to processes, doesn't it? So that's the shift, the cultural shift that needs to be made, perhaps, is one of, I want this, how much does it cost? Here's the money. And from that to what process is required here? Who do I need to know? Who do I need to meet? And what process and relationship do I need to create? It's a massive cultural shift, and something really useful, I think, to get your head around. So let's continue with the questions then. Thank you, Barak. My wife and I are currently working and plan to for a few more years before we retire and lose our healthcare with Cigna. Should we contact you and get insurance prior to us moving? This way we have a slight overlap of coverage. What does Serenity charge for this service? So two questions there: your fees, but also what you were talking about planning ahead. It doesn't have to be a couple of years, but what sort of overlap would be practically useful, Michael? And then what are your fees?
Let's start with the fees. They are very symbolic. We charge 180 euros per person per year. Something very, very, very symbolic for our services. This is simple. Overlap of insurances. Look, it's at the end of the day, it's a totally financial question. I mean, if somebody wants an overlap of insurance, this is everyone's and one's business. Be aware that you can't really, and this is where Nuno will note again, you can't really claim two insurance companies for the same act. So it will be either this or that. But what we normally say to people is that when coming to a new country, for sure coming to Portugal, if you have an overlap of insurance, this is nice. Try not to do too many gaps or too long of a gap in insurance, because sometimes insurance companies look at your last insurance as a key towards providing you some benefits. I don't know what, waiving off some waiting periods, covering you in a way better or whatever. And again, Nuno can confirm or say I'm totally wrong, but try not to stay like a year without insurance. Again, this is your business. But sometimes if you anyway have an insurance and you're kind of thinking of canceling it now or canceling it in 2 months, I think wait the 2 months and have even a small overlap, but on the long run, it will pay off.
Okay, excellent stuff. Thank you for that question, Barak. If there's anything else you need to know, do let us know in the chat. And there will be, when we stop the recording, there'll be a chance to ask questions in a more private environment. Shamim and Amin, this is a great question. A question for Michael or Nuno. Can travel insurance be used to see a doctor for a cough? Now, for a cough, that means you're concerned, I take it. It's up to you, isn't it, when you want to call on a doctor? If you have a concern, that can be arranged by Serenity.
Yeah, we can arrange to see whatever doctor for a cough or for whatever reason. I believe that the question is, would travel insurance cover something minor as cough?
Yes.
And the question is, again, depends. Travel insurance meant the normal travel insurance, the basic travel insurance, actually, meant to cover accidents and emergencies.
Yeah.
Some travel insurances would have some more into it, like exams, etc., etc. That truly depends on what kind of travel insurance did you buy. If you have the normal basic travel insurance, and you're going because there was an urgent need, and this urgency is as well explained in the medical report that you're going to submit to your insurance, most probably it will be approved. Again, I'm talking from the side of the user, advisor, and a medical person.
Yes.
Nuno can confirm that it will mainly depend on the approach of the insurance company, how flexible they are, and did the report really explain the urgency of this event of cough, for example.
Would you care to add something to that, Nuno?
Yes. So usually, and when I say usually is pretty in all of the situations, travel insurance or the travel insurer requires that the medical assistance must be preceded by a first call to a certain phone number.
Right.
And then they guide you through the system to see a doctor, to go to the hospital, transportation, and so on. So this is the first point of a travel insurance. You are not allowed to just go by yourself to a doctor and then ask for the reimbursement. Usually, travel insurance doesn't work this way. So This is the first. Second, usually, yes, travel insurance covers medical expenses due to a cough. But once again, you must call them. They drive you through an online doctor that can do a first consultation and investigate if you need a personal consultation or to go to a hospital or so on. So everything depends on the first contact with the insurer. But yes, also coughs can be and usually are insured.
Offered. Yeah.
Very good.
Let me just complement one good information that Michael did about travel insurance to the D7, about the 30,000 euros cap and repatriation cover. Also, the territorial scope, it has to be Portugal and Schengen area. Yes, Portugal is part of the Schengen area, but if they see clearly that is Portugal and the Schengen area, this is the requirement. Okay. Also, it must has no deductible. Okay.
Could you elaborate on that? So no deductible.
No deductible. Yes.
Right.
Traveling purposes.
Okay. Okay. All right. Thank you for that clarification. That's really good. I'm practically speaking here to answer that question. You know, if you feel unwell whilst traveling here in Portugal, rather than being on a helpline to your travel insurance company for an hour and then getting some information to go and see somebody and then keeping all the bills and so on, might it not just be easier, given the practicalities and the relative costs here, Michael, to call Serenity and have a GP appointment fixed up? It would be a whole lot simpler, would it not?
I think it's not even about cost and, you know, yes, it will be for sure much simpler instead of going on Google and asking Google where is the closest doctor. Sometimes Google will lead you to the wrong one, the one that wouldn't speak English, etc., etc. I think that the very most important thing is that you are sure that you're not going to be left alone.
Yeah.
And I think that this is very kind of, you know, provides you with a very important peace of mind during this phase that everything is new, everything is happening, quite a lot of things that are just overwhelming. At least here, if something happens, you don't have to think. You don't have to think like, whoa, what am I doing now? I don't know. Whatever. You pick a phone and you call somebody that already knows you, because we do this acquaintance immediately after somebody becomes a member. And I think that this is the most important thing, even before comparing if through us it will be more convenient or cheap or expensive or whatever. The thing that you can call somebody, talk to him in your own language. Those people will understand your clinical needs and assist you. It's like it's worth more than I think anything else. My perspective.
Yeah. No, I can see that, and you're probably not going to get that from a travel insurance call center. Fair to say. Okay, thank you very much for asking that question. That's very useful, Shamim. Gail, good evening to you. Thank you for being here. What format? This is a simple one. What format of medical records is suggested, if not paper or CD or DVD, for those tests and results that you might take in the best of circumstances or where they're appropriate and useful? What formats then, Michael, for the records?
So, look, it really depends on the type of records, as I mentioned before. Many of the records today, for sure, from the States can be digital. You can actually digitally access it, so you don't have to bring anything except for your password to your medical record in the States. Some of those would be exams on a CD, for example, mammography, etc.
Yeah.
The important thing here is the image, not the report. So the report in paper or in a PDF file would not give us anything. We really need the CD with the actual images of your mammography, as an example.
Yeah.
And this really varies between different types of medical exams or information needed. So again, if you talk to us, we will guide you accordingly to your background, what to bring and how to bring it.
There you go. For you, Gail. Ignace, thank you for being here tonight as well. Is the Portuguese base health system comparable to most European countries like the NHS in the UK? That's a very subjective and dynamic question, Ignace. And extra insurance is mostly for conditions that the base insurance does not cover. Now, we haven't really talked about this tonight, have we? About the interface, the overlap between the public and the private. You've been very helpful and very thorough tonight. What would you say about that overlap and
so,
the best of both
Ignace, thank you very much for this question, because it's a very important thing. It's a very important one. Comparable, yes. Different, by far, from the NHS or whatever. And here's a very simplistic way that I always mention when it comes to the balance between the private and the public sector. First, remember that the public sector is a good one. Actually, those are the same physicians that work here and there. They work in the morning in the public hospital, go to their private practice in the afternoon, or vice versa. So the quality is practically the same. And it's not like this one is better and this one is worse. No, it depends for what, better for what. And if we speak in a very simplistic and dichotomic way, it will work like that. Public system is very, very good for all the emergencies, urgent situations. If you're having a myocardial infarction in the middle of the night, you will be brought to a public hospital and you will be treated well there. No questions asked. If you have something very complex, God forbid, a very serious cancer, leukemia, you need a bone marrow transplantation, you need a liver transplant, public sector, and you will be treated very well there. On the other side of this spectrum, you just need your prescription medications. I already mentioned that the electronic prescription system by the public sector works tremendously well here. All good. And now, okay, so why do I need the private, sorry. And here's the thing. Try to just see an orthopedic surgeon for your pain in your knee in the public sector. It will take you 6 months. And you will be dragged through the system like no one else dragged you in your past in the States or whatever. Or you need an MRI, somebody sent you to an MRI that you want to do through the public sector, it as well might take 2-3 weeks until somebody answers you, and then they will schedule and whatever. And these are the things that the private sector actually does for you very efficiently, very quickly. You just need to pick the right place, the right physician that speaks English, etc., etc., etc. This is, again, a very simplistic thing. All the emergencies, all the very, very complex issues, public, medications, public, all the rest, all the ambulatory elective processes, seeing a physician to your choice, the one that speaks English. You live in Lisbon, but you want to see an orthopedic surgeon in Porto, private insurance, private hospitals, private clinics. Okay. Very simply stating.
That's wonderful and very helpful. Thank you, Michael. Paul Richards, this is great. Thank you, Paul, for this. These are the 3 acronyms in Portugal. We'll put the NIF number in there as well while we're about it. What's the difference between an SNS number, a NIS number, and a NIF number?
Yeah,
Michael?
There's a lot of mixture, actually. If you look at the answers of expats to expats on expats group, some of them say NISS, okay. NIF, Número de Identificação Fiscal. This is your fiscal number. Actually, you can't do anything without being fiscally traced. So this is your fiscal number. You can't move without the fiscal number in Portugal. Something that has nothing to do with your healthcare, actually. SNS stands for Serviços Nacionais de Saúde, National Health Services. This is your número de utente. This is your number of registration with the national healthcare system. What is it good for? Actually, this is your entry point to your eligibility for all the public care. And the most common utilization of such is when you get your prescription medications. I mentioned that each and every prescription, if they put in your SNS number, you're getting your medications for the SNS tariff, which is very, very low, or sometimes even for free. And ISS is your social security number. That, again, has nothing to do actually with healthcare. There are, by the way, we encountered several occasions on which people that went to their health centers were sent back because they didn't have social security number. This is somebody that was in this healthcare center, was like stuck several years back, I don't know how many, because many years ago, you had to have a social security number associated with your eligibility to healthcare. This is no longer valid. One, two, for sure not for people that came here to retire, for example. You're not working, you're not paying social security, you're actually getting your social security from your country of origin. So again, this supposedly has nothing to do with your healthcare.
Magnificent, Michael. The NIF, the NIS, and the SNS, they're beautifully described, and you may encounter all three of them, but most likely the NIF and then the SNS and NIS in some other exceptional circumstances. Jamina, what is the cost of the national health system per year? I'm not sure exactly what you mean. Which private insurance companies do you recommend to start the research and comparison process? Well, we recommend Nunu Mendes of Winsurance here, of course. But the cost of national health system, what do you think that means there for Jamina, Michael?
I believe that, and this is again a very nice question because it reminds me of something that I didn't mention, but here it is. Your eligibility for national healthcare system comes with your residence. It has nothing to do with costs. You're not paying for it, or sorry, I will rephrase it. You're paying for it without knowing, because the budget of the national healthcare system comes from the taxes that all of us pay. Taxes, I mean the VAT that you're paying for your coffee, or the tax that you're paying for your house when you bought it, or all the rest of the taxation system that exists in Portugal. So there is no specific tax for healthcare here. And hence, by the way, it has nothing to do with paying or not paying social security. So the national healthcare system doesn't cost you anything special. All of it comes from the governmental budget taken from the taxes that we are all paying.
There you go.
Private insurance companies, of course, talk to Nunu, or again, just to be very, very fair, the answer again depends. If Jamina, you're 22, you have a very broad option of choices. If you're 55, you have less. If you are 55 with pre-existing conditions, so it comes to a very short list. And if you are 22 with pre-existing conditions, we're back to this short list. Some of the insurance companies that we work with, you know what, look for the insurance company that would not throw you when you become 65 or something.
Yeah.
Look for an insurance company that would be easy to work with. Look for an insurance company that would cover pre-existing conditions if possible. And by the way, you know what? Here's maybe another thing, like it needs to fit you, but here's another good advice that I tell to everyone. Pick a broker that will answer your questions. Pick a broker that when you have a problem, you can call him and he will really be there for you and not tell you, I don't know, or wouldn't even pick a phone. And here, by the way, with all due respect, Nunu is one of these.
Go on.
It is what it is. No, really. I mean,
he is a big favorite in the community here for sure. And I suspect there are people who will gladly give a fantastic testimonial for Nunu tonight. Who will speak on it.
I'm saying, even before picking the insurance company, pick a broker that will really represent your needs and will be there for you.
Yeah.
Not only when selling your insurance. Speaking of the banks, remember the banks? Yep, try to go to your clerk at the bank and tell him, look, I have a problem with my Medish insurance. Mm-hmm. He will tell you, okay, push.
Yeah, call Medish, not us. And I did fall into that trap. I went for the convenience. This is long before Serenity and meeting Nunu. I was at the bank and offered a bank health insurance. My only question was, the price seems okay. I can do that with you now today, can I? Yes, that seems pretty good too. I need this. Is there a helpline I can ring and speak to somebody in English? And they said yes to that. And that was all I needed to sign the paperwork, which, as it turns out, wouldn't have been a very good policy. And I'm glad to have found Nunu instead subsequently. Couple more quickies then, because you've been amazing tonight, the Portugalizer. It's 10-9, would you believe? But a couple of quick ones, if we can squeeze these in and maybe go to opening the mics if somebody has a more personal question they don't want to ask on the recording. Isn't a supplemental policy only for issues not covered by a main policy? Can it stand as your only insurance coverage in Portugal since it doesn't function as a main policy in the US? Have you come across that, Michael?
I need to read it again.
The
Is it a supplemental
yeah, can you
policy?
just have the
Supplemental for
supplemental?
like Medicare?
Well, that maybe we'll go to Laurie after the end of the recording there. But I think the basis of the question is, can you only have the supplemental policy rather than getting an entire comprehensive policy? But we'll check with you afterwards, Laurie, on that. This is a good place to conclude for tonight, I think. What about nursing home care and memory units? Now, this is a new consideration.
Oh.
We've had conversations about this, haven't we, Michael? And it is
We spoke about it
Yes.
only recently, right?
Yeah.
Look, nursing homes and continuous care and care for disabled people and people with dementia, Alzheimer, whatever, is a big issue in Portugal. Unfortunately, Portugal doesn't have this system very, very well deployed and developed. We can elaborate about it. It's a little bit of philosophic. I love those philosophies of healthcare. But I'll tell you my perspective, and it's only my perspective, okay? The thing is that Portugal for years and still today has this social attitude. And it works well as long as everybody is entitled to care, blah, 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 all of this, great. But then when the country becomes older, when the people become older, when there's a growing demand for continuous care, and this is a care that costs a lot of money, the system can't support it. And this old structure of treatment of people with high demands, a lot of people with high demands actually is crushing. And today, the support by the state for those in this kind of specific need is very, very poor. Yeah. So the nursing homes, you have few, like I can count them maybe on a palm of my hand and a half, that will be private on a high level. They will be tremendously expensive, and there's no structure to support it. There, for example, no true insurance, long-term insurance for nursing needs, etc., etc. We spoke about it even with Nuno. So there's no financial engine to feed this system, and hence either you have several sporadic, very expensive places and with a long waiting list, or you have the very mediocre places that would charge 1,000 euros per month, but with, like, I hate to say it, this is not a nursing home. This is a place where you deposit your elderly parent, and that's it.
Yikes.
This is a very, very, very painful point. I hope that in the future, I mean, the power of the need and the necessities, whatever, will drive somebody towards this solution, together with proper financial engines that would feed the system. But again, this is a little bit of philosophy.
Thank you for your honest and frank approach to that. It is a live issue, isn't it? This is a demographic issue all around the world. Portugal is not alone in facing this. This needs to be an ongoing conversation, which we will continue to have. The Portugalizer, Dr. Michael Averbukh, you have been magnificent this evening.
Thank you. It's a pleasure.
A very simple, top line of the insurance, the continuum of care, and then the prescriptions, and then the deep dive into all of that means. We need your contact details on the screen, of course, but you can find Serenity in the Expats Portugal business directory at expatsportugal.com. Just click on that tab and you'll find Serenity there. I'm going to stop the recording now. Thank you so much, Michael, and thank you, Nuno, for your contributions as well. Really appreciate it.